Ma'am, I need you to step away from that patient right now.
I'm in the middle of a patient assessment here.
I don't care what you're doing. You need to leave this room.
There must be some mistake. I'm working right now.
Huh, okay, sure. You can wait in the waiting area with family.
I can't leave, not right now. This patient is critical.
You're making this really difficult for yourself. Hands behind your back.
Ma'am, I need you to step away from that patient right now. Metropolitan General Hospital, ICU Bay 7, 2:14 a.m. The fluorescent lights hummed overhead. A ventilator hissed rhythmically. Somewhere down the hall, a cardiac monitor alarm chirped. Dr. Simone Whitmore looked up from the tablet where she'd been updating vitals. Her patient, a 19-year-old gunshot victim, was critical. She had maybe 90 seconds left in her assessment. I'm in the middle of a patient assessment. Can this wait 2 minutes? Officer Marcus Chen's hand moved toward his restraints. No, ma'am. Step away now. The oxygen line hissed. The monitor beeped. Dr. Whitmore's scrubs rustled as she turned to face the officer fully. What happened in the next 8 minutes would expose a pattern of racial profiling that had been ignored for 3 years. It would cost an officer his badge, his career, and his future in law enforcement. But first, it would reveal who had the real authority in that room. To understand why this moment was about to become a career-ending mistake for Officer Marcus Chen, you need to know who he was interrupting. Dr. Simone Whitmore, 42, RN, MSN, DNP, was the head of critical care services at Metropolitan General Hospital. She'd earned her bachelor's in nursing from Johns Hopkins in 2005, graduating summa cum laude. Her master's in nursing came from UCSF in 2009. By 2013, she completed her Doctor of Nursing practice from Columbia University. 15 years of critical care experience. She'd started as an ICU nurse, became charge nurse within 3 years, and was promoted to nurse manager by year 7. Now she managed an 87-bed critical care unit with 240 nursing staff and a $47 million annual budget. Under her leadership, ICU mortality rates had dropped 18% through protocol innovations she'd designed. She'd published 12 peer-reviewed articles in critical care journals. She served on the American Association of Critical Care Nurses National Board. The CDC had consulted her on ICU preparedness protocols. She testified as an expert witness in 7 medical malpractice cases. Dr. Michael Torres, Metropolitan General's chief of medicine, said it simply, "Simone is the person I want managing care if my own family is critical. Her clinical judgment is impeccable, and her leadership transformed our ICU into one of the top-rated units in the state." A single mother of 2 teenagers, a volunteer who trained nurses in underserved communities, a mentor to young Black women pursuing healthcare leadership. On the night of March 17, 2023, she was 11 hours into a 16-hour shift, covering a staffing shortage, managing 4 critical patients including the gunshot victim who'd just come from the OR. None of that would matter to Officer Chen. Officer Marcus Chen, 26, badge number 4479, had been with Metro City Police Department for exactly 13 months. He'd graduated from the police academy in June 2022, ranked 23rd out of 47 cadets. Average scores in de-escalation training, 73%. He'd passed the constitutional law module with the minimum required 70%. Chen grew up in suburban Metro City. His father was a firefighter. He described his motivation for joining law enforcement as wanting to make a difference. His current assignment, night shift patrol in the downtown district, usually partnered with 9-year veteran officer Sarah Martinez, though she wasn't with him that night. In his first year, Chen had made 37 arrests. Department average for rookies was 28. He'd received 3 commendations for traffic enforcement. His supervisor evaluations described him as eager and assertive. But there was something else in his personnel file. 4 civilian complaints in 13 months, department average, 0.8 per year. All 4 complaints filed by Black civilians, alleging racial profiling. All 4 investigated by Sergeant David Keller, Chen's direct supervisor. all 4 dismissed as unfounded or unsubstantiated. 3 of those complaints involved Chen questioning black professionals in areas where he assumed they didn't belong, an attorney entering their own office building, a teacher in a school parking lot after hours, a business owner opening their store early morning. Chen considered himself a proactive officer. He believed his high arrest numbers proved his effectiveness. 2 weeks earlier, a new lieutenant had taken over night shift supervision. She hadn't yet reviewed Chen's file. March 17, 2023. Friday night bleeding into Saturday morning. 2:14 a.m. Clear night, temperature 48 degrees. Metropolitan General Hospital, a 640-bed level eye trauma center in downtown Metro City, served predominantly black and Latino neighborhoods. Dr. Whitmore had started her shift at 7 p.m. Friday. Now, 7 hours past when most people go home, she was checking monitors on Terrence Williams, a 90-year-old gunshot victim who'd come from surgery 2 hours earlier. His vitals were holding, but barely. She wore navy blue scrubs with Metropolitan General Critical Care embroidered on the chest. Her hospital ID badge hung on a lanyard around her neck, photo, full name, title Head of Critical Care Services, clearly visible. Stethoscope draped over her shoulders. Officer Chen had responded to a domestic disturbance call in a different wing an hour earlier, a family dispute over end-of-life decisions. After resolving that call, Chen decided to check on the gunshot victim from a shooting he'd responded to earlier that evening. He entered the ICU without coordinating with the charge nurse. Hospital protocol required officers to check with nursing supervisors before entering patient care areas. Chen saw a black woman in scrubs standing next to his gunshot victim. He made an assumption. Dr. Whitmore's first thought when Officer Chen interrupted her. He needs information about Terrence's condition for his report. She assumed he'd wait 2 minutes while she finished documenting vitals. She assumed wrong. "Ma'am, I need you to step away from that patient right now. Are you family?" She looked up, confused but professional. "I'm his nurse. I'm in the middle of an assessment." "No, ma'am, I need you to leave this room immediately. You need to be in the waiting area with the other family members." Officer Chen stood in the doorway, blocking her exit. His hand rested on his utility belt near his handcuffs. Dr. Whitmore straightened. "Officer, I'm Dr. Simone Whitmore. I'm the head of critical care. This is my ICU. This is my patient." She pointed to her ID badge hanging at chest level, her photo, her full name, her title, Head of Critical Care Services, the designation, All Access Medical Staff. Chen barely glanced at it. "Anyone can get a fake badge. I need you to step away from the patient now. This badge is issued by hospital security. You can verify my identity with the charge nurse at the station or with hospital security." "Ma'am, I'm not going to ask again. Step away from the patient." "You're really going to do this?" Dr. Whitmore kept her voice calm, controlled. "Look, I don't know how you got in here, but this is a secure area and you need to leave." She felt it then, the shift. This wasn't about protocol, this wasn't about the patient. This was about what she looked like. "Officer, I understand you're concerned about the patient, but I'm his attending critical care physician. I have not only the right but the responsibility to be here. Just cooperate and we won't have a problem. Why are you being difficult?" "I'm being difficult by doing my job, by taking care of a critical patient. I'm asking you to verify my credentials before you continue. Call your supervisor. Call hospital security. They will confirm who I am. Hospital policy is you follow police instructions. I'm instructing you to leave." Dr. Whitmore reached for the room phone. "I'm calling my supervisor and hospital security to verify my identity." Chen stepped forward. "Ma'am, put the phone down. Put your hands where I can see them." She placed the phone down slowly, turned to face him fully. "My name is Dr. Simone Whitmore. I am the head of critical care services at this hospital. I supervise 240 nurses in this unit. My office is on the 7th floor. My direct line is extension 4701. 3 seconds of silence. Chen's hand moved to his handcuffs. Turn around and place your hands behind your back. On what grounds? What crime do you believe I've committed? Trespassing and interfering with a police investigation. The handcuffs came out. I'm asking for your badge number. I'm asking you to call your supervisor. Officer, what is your badge number? 4479. Turn around now. The metal was cold against her wrists. This interaction is being recorded on your body camera. I am not resisting. I am complying under protest. You are handcuffing the head of critical care while my critical patient is unmonitored. The handcuffs clicked shut at 2:22 a.m. 8 minutes of interaction. Officer Chen walked Dr. Whitmore toward the ICU exit, past the nursing station, past her staff. Charge nurse Jessica Rodriguez saw them first. Officer, what are you doing? That's Dr. Whitmore, that's our director. Chen's voice went defensive. She was refusing to leave a patient room. She wouldn't identify herself. She's wearing her hospital ID. She runs this entire unit. You just handcuffed our boss. Dr. Whitmore's voice remained steady despite the restraints cutting into her wrists. Officer Chen, badge 4479, I'm going to ask you specific questions. What reasonable suspicion did you have that I was committing a crime? You were. You didn't have authorization to be in that room. What made you believe I didn't have authorization? Did you see me do something suspicious? You were standing next to a shooting victim. You could have been interfering with evidence. Did you observe me tampering with evidence? Or did you just assume I didn't belong there? Hospital security officer David Washington arrived, recognized Dr. Whitmore immediately. Sir, you need to remove those restraints. That's Dr. Whitmore. Chen's face flushed. She wouldn't verify her identity. 3 ICU nurses watched from the nursing station. One was recording on her phone. Dr. Whitmore's voice cut through the tension. I showed you my hospital ID. I stated my name and title. I offered you 3 ways to verify my identity. You chose to handcuff me instead. Why? Hospital policy says. I write hospital policy for critical care. Officer, you violated my 4th Amendment rights. You detained me without probable cause. Did you verify anything before you entered my ICU? Chen's hand trembled as he reached for the handcuff key. Your body camera has recorded this entire interaction. I want your supervisor called. I want a supervisor here now. The handcuffs came off at 2:24 a.m. Dr. Whitmore rubbed her wrists. David, please call Lieutenant Morrison and call hospital administration. I'm filing a formal complaint. To Chen, stay here. Your supervisor will want to speak with you. She returned immediately to Bay 7. Her patient's oxygen saturation had dropped while she was gone. Lieutenant Sarah Morrison arrived at 2:47 a.m. 16 years with Metro City PD. Dozens of officers supervised. She'd never walked into a scene quite like this. One of her officers standing in an ICU, body camera recording, having just handcuffed the hospital's head of critical care. Morrison reviewed the body camera footage on scene. Security cameras captured her facial expression, shock transitioning to anger. Her orders were immediate. Chen returned to the station. Now you're done for the night, write nothing, speak to no one. She met with Dr. Whitmore in a private office. Dr. Whitmore, I apologize. I need your detailed statement. Here's the internal affairs direct line. Dr. Whitmore's response was measured. Lieutenant, I appreciate your response, but I need you to understand, this isn't about one bad interaction. I need to know if this officer has done this before, and I need to know that there will be accountability. Morrison's promise. Dr. Whitmore, I just took over this shift 2 weeks ago. I'm going to review every call this officer has been on. You have my word. By 6 a.m., Chen was on administrative leave, badge and service weapon secured. By 9 a.m., the hospital's CEO and chief of staff personally met with Dr. Whitmore, offering full support for any legal action. By 8 a.m., a hospital staff member had posted about the incident on social media. By noon, local news requested comment. Internal Affairs assigned 2 senior investigators within 48 hours. The Internal Affairs investigation took 11 days. Captain Patricia Williams, an 18-year veteran investigator, led the team with Sergeant James Martinez. They reviewed 47 hours of body camera footage from Chen's 13 months of service, 23 dispatch records, Chen's complete personnel file dating back to the academy. They interviewed 47 people, hospital staff, civilian complainants, fellow officers. Dr. Whitmore provided a detailed 8-page statement and sat for 2 recorded interviews. Chen was interviewed on March 21st. His defense: "I felt something was off about her presence. She could have been anyone. I was just doing my job." The investigators asked him what specifically was off. He couldn't answer. Dispatch records showed Chen never called for verification before detaining Dr. Whitmore, never contacted hospital security, never requested backup until the confrontation had already escalated. But the investigators found something else. 4 previous complaints against Officer Chen. Every single one involved a black civilian. Every single one followed the same pattern: vague call, assumption-based stop, dismissal of credentials, escalation. All 4 had been investigated by Lieutenant David Keller, Chen's previous supervisor, until 2 weeks before the Whitmore incident. All 4 were marked unfounded or unsubstantiated. The investigators contacted the previous complainants. Marcus Thompson, 38, attorney, stopped while entering his law office at 6 a.m. in July 2022. Chen demanded proof Thompson worked there. 23-minute detention. Complaint dismissed. Officer acted appropriately given early morning circumstances. Alicia Rodriguez, 32, high school teacher, questioned in the school parking lot at 7 p.m. in September 2022 after parent conferences. Chen accused her of trespassing, only verified her employment after the principal intervened. Complaint dismissed. Insufficient evidence of bias. James Wilson, 45, restaurant owner, stopped while opening his restaurant at 4:30 a.m. in November 2022. Chen questioned his right to be there, demanded ownership papers. Complaint dismissed. Officer exercising reasonable caution. Kenya Patterson, 29, accountant, stopped while jogging in her own neighborhood at 5 a.m. in January 2023. Chen demanded ID and explanation for suspicious behavior. Complaint dismissed. Unfounded allegation. The pattern was undeniable. All 5 incidents, including Dr. Whitmore, involved black professionals. All occurred during non-traditional hours. All involved Chen questioning their right to be in a location. All involved legitimate, lawful activity. All showed Chen's resistance to accepting credentials. The investigation report stated, Officer Chen demonstrated a consistent pattern of racially biased stops targeting black professionals during lawful activities. This pattern was documented through complaints, but was not appropriately investigated or addressed by supervisory staff. Dr. Philip Goff from the Center for Policing Equity reviewed the case. This demonstrates how implicit bias manifests in policing, the assumption that black professionals are out of place in certain contexts. When 4 complaints show the same pattern and all are dismissed, that's not 4 isolated incidents. That's institutional failure. Statistical analysis revealed Chen stopped black civilians at 67% of his stops, despite district demographics being 34% black. He requested ID from black civilians 89% of the time versus 23% for white civilians. The investigators' conclusion: Officer Chen's actions were not a momentary error in judgment. The evidence demonstrates a sustained pattern of racial profiling that was reported, documented, and ignored by his supervising sergeant. The investigation's findings were delivered to the Chief of Police on March 29th. The recommendation: termination. Officer Marcus Chen was terminated on April 3, 2023, 13 days after he handcuffed Dr. Whitmore in her own ICU. The police union initially filed a grievance challenging the termination, arguing Chen deserved a retraining opportunity. They withdrew the grievance 3 weeks later after reviewing the body camera footage and complaint history. There was no defense for what the evidence showed. Chen appealed to the Civil Service Commission. On June 12, 2023, the commission voted 5-0 to uphold the termination. The district attorney declined to file criminal charges. Insufficient evidence of criminal intent for false arrest. Civil rights organizations criticized the decision. Dr. Whitmore filed a federal civil rights lawsuit under 42 U.S.C. Section 1983, seeking $2.7 million for Fourth Amendment violations, emotional distress, and civil rights violations. The case settled in September 2023 for $875,000, paid by the city. On August 4, 2023, the State Peace Officer Standards and Training Commission revoked Chen's law enforcement certification. He cannot work as a police officer anywhere in the state. The revocation was shared with the National Decertification Index. Chen is effectively barred from law enforcement careers nationally. He cannot work as a security guard in any capacity requiring state licensure. Chen relocated to a different state by November 2023. He now works in his family's restaurant business. He has issued no public statement, no apology. But Chen's termination was just the beginning. Sergeant David Keller, who had dismissed all 4 previous complaints, was demoted to patrol officer, transferred to a different shift in district, lost his supervisory pay, an $18,000 annual reduction. Lieutenant Brian Foster, Keller's supervisor who failed to catch the pattern, received a written reprimand and mandatory leadership training. The financial toll on Metro City: $875,000 in settlement, $143,000 in legal defense costs, $2.3 million in federal consent decree compliance costs over 3 years, $487,000 in first-year training implementation. Total financial damage: $3.8 million. The department implemented comprehensive reforms. All bias-related complaints must now be investigated by internal affairs, not direct supervisors. Minimum 14-day investigation period with mandatory complainant interviews. An external oversight board reviews all unfounded determinations. A civilian review board was created with subpoena power. 9 members, 5 appointed by City Council, 4 by the mayor. The board reviews all use of force incidents and bias complaints. An early intervention system now tracks all officer stops with demographic data. The system automatically flags officers who stop minorities at rates 25% above district demographics. Supervisors receive monthly reports. A public dashboard shows stop data by officer, district, and demographics. Body cameras must now be activated for all public contacts, no longer officer discretion. Supervisors must review footage for any complaint within 48 hours. 10% of all footage is randomly sampled. LED for quality assurance. Public access to critical incident footage expedited to 14 days. Training curriculum was overhauled. Implicit bias training increased from 4 hours to 16 hours annually. A new A-Tower constitutional policing course focuses on Fourth Amendment rights. Scenario-based training now uses actual complaint cases, including the Whitmore case. Healthcare, legal, and business professionals serve as guest instructors for cultural competency training. Supervisors are now evaluated annually on complaint resolution, demographic stop data for their officers, and early intervention in problematic patterns. Promotional opportunities are tied to accountability metrics. A new memorandum of understanding with all hospitals requires officers to check with nursing supervisors before entering patient care areas except for active threats. Officers must receive hospital orientation on staff identification systems. Officers now have mobile terminal access to hospital staff databases to verify credentials. The department reviewed 847 complaints from the previous 5 years. External consultants identified 34 complaints that had been inadequately investigated, 12 patterns involving 7 different officers. 3 additional officers were terminated. 11 previous complainants received settlements and formal apologies. The chief of police personally apologized to Dr. Whitmore in a public city council meeting. Dr. Simone Whitmore is still the head of critical care at Metropolitan General Hospital. In 2024, she was promoted to Vice President of Nursing Services, overseeing 640 nurses across the entire hospital system. She developed a national training program, healthcare professionals and law enforcement, mutual respect protocols. It's now used in 47 police academies and 120 hospitals. She's testified before 3 state legislatures on police accountability legislation. She consulted with the Department of Justice on hospital access policies for law enforcement. In the Journal of Emergency Nursing, she published, "When Bias Enters the ICU, Protecting Healthcare Workers from Racial Profiling." Metro City PD's bias complaints dropped 64% in the 3 years since reforms were implemented. But complaints are now investigated more thoroughly. Substantiation rates increased from 4% to 22%. The Early Intervention System has flagged 23 officers in 2 years. All received additional training. 4 were transferred to non-patrol assignments. The Civilian Review Board has sustained 31% of complaints it reviewed. Under the previous system, 4%. Dr. Whitmore's body camera footage, with her permission, is shown in over 200 police academies as a cautionary example. 3 law schools use the case in constitutional law courses. The ACLU uses it in Know Your Rights presentations. The case exposed how racial profiling operates even in institutions, the assumption that Black professionals are out of place in positions of authority. It showed how individual bias becomes institutional failure when supervisors protect rather than correct problematic patterns. It proved that even credentials, authority, and expertise don't shield Black professionals from being presumed suspicious. Dr. Whitmore said it clearly in her testimony to the state legislature. "I didn't file that lawsuit for money. I filed it so the next Black professional stopped by an officer who assumes they don't belong has a precedent. Evidence matters, accountability matters, and assuming someone doesn't belong somewhere because of their skin color, even when they're wearing their credentials around their neck, that has to cost something." It finally did. Dr. Whitmore still works overnight shifts in the ICU. Same hospital, same bays, but now when officers enter for legitimate reasons, they check with the charge nurse first. They verify, they ask. Because evidence doesn't lie. Bias does. If this story opened your eyes to how profiling operates, even within institutions that should know better, share it. Your engagement helps these stories reach people who need to see them. Every share reaches someone who's experienced something similar. And if you have experienced something similar, you're not alone. Know your rights, demand accountability, document everything. Thanks for watching.